Dear Kräutermix clients and business partners, I'm very happy to welcome you to this year's online workshop with the topic Phytotherapy for Orthopedic Pain in Horses and Dogs. My name is Katja Görts. I'm a veterinary practitioner and I'm passionate about herbs, and I'm very happy that Kräutermix invited me to speak to you about 4 important herbal remedies for the treatment of orthopedic pain in dogs and horses. I graduated from the Tierärztliche Hochschule Hannover in 1999. I'm certified in traditional Chinese veterinary herbal medicine, in acupuncture and in chiropractic, and since 2009 I'm running my own practice. I'm specialized in phytotherapy, traditional Chinese veterinary medicine, osteopathy and chiropractic. And since last year, I'm the president-elect of the International Veterinary Acupuncture Society. Today, I want to discuss 4 plants with you. The first is turmeric or curcuma longa, frankincense, also known as Boswellia, meadowsweet, in Latin Filipendula umaria, and willow bark, which belongs to the Salix family. We're going to talk about where these plants come from and how they act in the body, what their scientific evidence is, in which indication and dosages we can use them, and I would like to present some cases of my own practice to you. I will now switch off the camera so that it's not covering the text on the upcoming slides, and I hope you enjoy the presentation. Thank you very much. Here you can see turmeric as a crude drug. This is the quality like you can get it from Kräutermix. So it's one of the qualities they're offering. And the intensive orange color is a sign for a good quality. So we're saying that a good quality turmeric has this intense, dark orange yellow color. In comparison to the last slide, you see here curcuma like it is harvested. Curcuma, like ginger, belongs to the family of Zingiberaceae. And we're using the dried rhizome, so the part that grows underneath the earth. It is native to Asia and Africa, but it is intensively cultivated in China, India, and other countries throughout the tropic regions. The constituents that are important to us are curcuminoids, volatile oils, namely monoterpenes and sesquiterpenes like zingiberine, curcumine, and alpha and beta turmerone. And the curcuminoid complex, it's also called Indian saffron, and there you can see again the relation to the color yellow. The clinical actions of turmeric, it's anti-inflammatory, antioxidant, and antiplatelet. So everybody, I think, has already heard the term reactive oxygen species or free radicals, meaning things like ozone that are highly reactive with cells and can destroy them. And curcuma is a strong antioxidant that helps avoid cell death caused by reactive oxygen species. And antiplatelet means that it has a positive effect on the blood flow by preventing platelets from clotting together. Furthermore, it has hepatoprotective effects, so it protects the liver from damage, and also increases bile secretion, so it has a cholagogue effect. This next slide looks pretty crowded. The reason for it is that turmeric has a pretty good general research database, and all the data I'm presenting here is derived from cell culture studies or studies made in laboratory animals or humans. First of all, turmeric has a low bioavailability. There's some reasons for it. The first is that turmeric is lipophilic, meaning it loves fat and it does not like water. But for the body, it's easier to absorb substances that are hydrophilic, so that like water. A second reason is that turmeric has a very intense first pass mechanism, meaning it's easily metabolized in the liver and excreted via the bile fluid and the feces. There are some things that we can do to increase the bioavailability of turmeric. One is, of course, to use a very high quality crude drug with a high curcumin content. A second possibility would be to combine it with black pepper. There are human studies that showed that adding only 1% of black pepper to the ration increases the bioavailability of curcuma about 20-fold. And the reason for it is that the black pepper slows down the first pass. So curcuma is not as fastly metabolized by the liver. Furthermore, we could combine it with fat. When you think of curries, the rich yellow color of curries comes from the turmeric in them. And they're often made with coconut oil or coconut milk, which is high in fat and helps the gastrointestinal cells to absorb the turmeric. Modern formulations use so-called micelles or phytosomes. Those are little drops that are lipophilic on the inside, incorporating the turmeric, and hydrophilic on the outside, which helps the body to absorb the turmeric better. All that said, it is shown in human studies in people suffering from colon cancer that turmeric accumulates in gastrointestinal cells, and that might be an explanation for the good anti-inflammatory effects of turmeric in inflammatory bowel diseases like morbus Crohn or ulcerative colitis. Curcuma is highly pleiotropic, meaning it interacts with several molecules that are involved in inflammatory processes in the body. And it inhibits pro-inflammatory cytokines and catabolic enzymes, and it does not only directly infect inflammatory diseases, but also helps with pruritus, so with people who are itchy because of allergies or atopies, and it has an effect on certain cancer cell lines in cell culture studies. We already discussed that it's a scavenger of reactive oxygen and nitrogen species, so has antioxidant effects. And in animal studies, it showed, namely in mice, that it reduces the inflammatory edema that was experimentally induced. So those mice get injected with a very aggressive substance into their paws, and pre-treatment with curcuma showed that it was as nearly as effective as phenylbutazone or shortly bute and steroids in similar doses. In human patients with osteoarthritis of the knee, it showed comparable effects with bute and had a lower ulcerogenic index, so it does not upset the stomach as much as bute does. And it showed no acute toxicity in acute as well as in chronic phases, meaning there was no such harmful effects on the liver and the kidneys, for example. There is some veterinary research about turmeric. There's one study evaluating the therapeutic effect of curcumin in horses affected by degenerative joint disease. Degenerative joint disease meaning chronic inflammation of the joint that slowly, progressively destroys the joint. And the current assumption is that repeated mechanical stress together with reactive oxygen species is responsible for this. And with time, all this together leads to destruction of the cartilage of the joint and to osteophytes and pain. So in this study, 7 adult mares with chronic osteoarthritis and 5 foals with osteochondrosis were examined. And osteochondrosis is a disease that affects mostly young animals. And one reason for it is if they were overfed at young age, then they grow too fast and the cartilage of the long bones cannot grow as fast as the bones do, so it gets thinner and thinner. And then one day it ruptures and a little piece of it separates from the underlying tissue. And then when we have what we call a chip, so the little piece of cartilage that is freely floating inside the joint cavity. Usually a joint is an isolated compartment of the body and it's protected by the joint capsule. And if cartilage damage occurs and the bony surface lies in the open, then immune cells in the synovial or joint cavity attack this bony surface because they regard it as a foreign body, which leads to inflammation and pain. In this study, the improvement of lameness was not the primary goal. Instead, the researchers looked at the effects of curcuma on a molecular level, and the results showed that the curcuma downregulates genes that are coding for pro-inflammatory mediators and catabolic enzymes that are destroying the cartilage. And on the other hand, they showed that interleukin 6, which is a inflammatory mediator, but this is a good one because it's chondroprotective, so it protects the cartilage from damage, and this is upregulated in the foals in this study. Summing up, we could say that in this study, turmeric shows to reduce pro-inflammatory cytokines and catabolic enzymes and increases chondroprotective interleukin 6 in foals. A comparable study conducted with the same phytosomic preparation of turmeric in dogs with osteoarthritis evaluated the effects of turmeric on a molecular level. So again, the clinical appearance of the disease was not the first goal of the study, but the molecular changes the turmeric had. So included in the study were 18 rescue dogs, 6 of them healthy and 12 with different stages of osteoarthritis. They were divided into 3 groups. One group received turmeric 4 milligram per kilogram twice a day. The second group received a conventional drug name is firocoxib. This is given once daily in a dosage of 5 milligram per kilogram body weight, and the healthy dogs received no treatment. So one of the results of this study was that the articular function of the patients was improved. So when we're talking about articular functions, it means that we examine the range of motion actively and passively. So trying to flex and extend a joint and see how far we can do that. And of course, how much weight the dog is bearing on the leg. And on the other hand, like in the horse study, there was a significant reduction of pro-inflammatory cytokines and macrophage activation. Macrophages are certain inflammatory cells. And there was an activation of fibrinolysis compared to the nonsteroidal drug, the firocoxib, that was given in this study. Fibrinolysis is important in osteoarthritis because during inflammatory processes of the joints, fibrin is produced and as inside the joint and also in the joint capsule, and leads to a thickening of the joint capsule and to fibrin complexes inside the joint. So it can affect the joint function mechanically, leading to what we see as stiffness in these patients. So curcuma might be able to break up these fibrin complexes and improve joint function and range of motion in these cases. Turmeric can be used either solely or in combination. It's quite often combined with frankincense or Boswellia, which we will discuss later on in this presentation. There is some combination with green tea, and there's a study published in Horses that showed that not in orthopedic condition this time, but in experimentally induced hepatitis, so inflammation of the liver, horses that received a combination of green tea and turmeric showed lesser inflammation response compared to horses that received placebo control. And it is said that green tea increases the effectiveness of turmeric. Traditional usage in humans is peptic ulcer, rheumatoid arthritis, pain of any kind. It's anti-inflammatory and tonic, and many other indications. So it's quite a broad spectrum usage here. And in veterinary medicine, it is traditionally used for external applications or topic applications, like in dermatitis of any kind, either bacterial or viral or parasitic, in wounds with bad healing tendency or complicated healing, in castration wounds, in gastrointestinal and respiratory disorders, in rheumatism, and in colic. And colic means abdominal pain in general. As far as contraindications and side effects are concerned, turmeric should be handled with caution in patients that are receiving antiplatelet or anticoagulation medication, because we said it had an antiplatelet effect. And of course, as it is cholagogue, it should be handled with care in patients that have gallbladder stones, because it might increase the bile flow and that can lead to gallbladder colics. So all the dosages I'm discussing here today are usually not based on evidence-based studies to find the perfect dosage for a dog or a horse, but are empiric. So they are based on the year-long usage of the herbs we're discussing, just to make sure that there's no really, like it is in conventional drugs, a dose finding study or something. With turmeric, the dosage depends on the curcumine content of the crude drug and, of course, as we discussed before, the preparation. So in dogs, we have standardized curcumin dose of 50 to 250 milligrams per kilogram 3 times a day. The dried herb is given in a dosage of 50 to 600 milligram per kilogram per day, optimally divided into 3 dosages. And with the phytosome formulation that is used in the studies we just discussed, the dosage is 4 milligrams per kilogram 2 times a day. In horses, the standardized curcumin dosage would be 1200 to 1400 milligrams per day. The dried herb is given in a dosage of 5 to 10 grams per day, and the phytosome formulation is given in a dosage of 4 milligram per kilogram once a day. Personally, I tend to start with small dosages and slowly increase the dosage to see how the patient reacts. That's the one thing, and how much the individual patient needs to have a significant clinical effect, or if there's one at all. I mean, not everybody's a responder. So, and the other thing is that there's nothing worse that can happen that you start with a high dose and 3 days later, for example, the dog eats something in the field and gets diarrhea or vomits or whatever, and that has nothing to do with the drug, or the herb, but the owner will automatically make the herb responsible for the reaction. So I really tend to start with low dosages and slowly increase them until I have the desired effect, or if there's no effect, I have to change the herb. So this is a very important thing to me to add. What is striking here is that horses, compared to the dog and compared to the body weights or the different body weights they have, receive much smaller dosages. So for me, the reason for this is that horses are animals of flight, so they have a different nerve system. They are much more prone to react very fast to any threat that's coming along the way. So they are very sensitive to herbs and usually need, in comparison to the dog and the body weight, much smaller dosages to react. So please don't compare these two directly, because it's two different animals, and one is really an animal of flight and the other one is a even more domestic animal that is protected by us human beings. So that might be the explanation for this effect we're seeing with the dosages, different dosages in dogs and horses. Just a reminder, if somebody wants to use the crude drug or the dried herb, please remember to combine it with some fat in the ratio. So in dogs, I prefer to use high quality fish oil, like made from salmon or sardines, with a high omega-3 fatty acid content. Because we can add some omega-3 to the diet, and that has potential anti-inflammatory effects too. With horses as plant eaters, I prefer flaxseed oil or linseed oil that are sources for omega-3 fatty acids as well. So the next herb I would like to introduce you to is frankincense, or Boswellia. On the left side you see the crystalline resin as Kräutermix provides it to you. The quality criteria is the lighter the resin, the higher the quality, and the quality depends on the time of harvest. And on the right side you see a frankincense bush in its natural habitat. Frankincense or Boswellia is also known as olibanum. And when we're talking about medicinal frankincense, we are usually referring to Boswellia serrata, the Indian species. Sometimes also Boswellia caterii, the African frankincense, is used, but it plays a smaller role. And science is still discussing if the two are to be used equally for similar indications, or if they are different from each other as far as their effects are concerned. So this is still a subject to further research. Boswellia belongs to the family of Burseraceae, and the herb we're using, the crude drug, is the resin of bushes and trees that are native in India, Africa, and the Arabian Peninsula. The Indian name of Boswellia suggests that elephants consume it as part of their natural diet. And this is called zoopharmacognosy, meaning that the animals are instinctively feeding on plants that have healing properties or constitutional effects on their health and well-being. The biological activities of frankincense are mostly attributed to essential oils and non-volatile D and triterpenes. And the main constituent or the main active constituent in research is boswellic acid. And its clinical actions are anti-inflammatory, anti-rheumatic, anti-arthritic, analgesic, which means pain-killing, immune modulating, and or suppressant. And this is the reason why it is often compared to the effect that cortisone has in the body or steroids have in the body. The big advantage of frankincense is that it does not have the negative side effects that cortisone evoke. To date, the scientific consensus is that frankincense inhibits 5-lipoxygenase or 5-LOX shortly, and has clinical actions comparable to cortisone. The inhibition of 5-LOX leads to reduction of leukotrienes, and leukotrienes are mediators released by leukocytes, macrophages, and certain tumor cells. They are adding to the inflammatory response by attracting other inflammatory cells to the inflammation site, promoting the adhesion of inflammatory cells, for example, to blood vessel walls, and increase their permeability. That leads to an extravasation of plasma, which creates edema in the surrounding tissue and promotes further inflammatory processes. It's like a vicious circle. Furthermore, frankincense inhibits the degranulation of free radicals, or like I already mentioned, reactive oxygen and nitrogen species that can be toxic to cells and destroy them. Furthermore, Boswellia inhibits the enzyme elastase. Elastase is an enzyme produced and released by leukocytes, and it breaks down proteins, for example, cartilage tissue. Cartilage is, amongst others, made from so-called glycosaminoglycans, and these are very complex molecules. And research in vital joints showed that degradation of glycosaminoglycans, like it is often present in inflammatory joint diseases, can be decreased by frankincense. There is data in human beings and animals that both the impairment of joint function as well as pain can be positively influenced by giving Boswellia, and this counts for rheumatoid arthritis, or for like acute onsets, as well as for chronic osteoarthritis. In a veterinary study, 24 dogs with osteoarthritis of the joints or spine were treated with frankincense. There was no placebo or control group. Patients showed permanent or intermittent lameness, joint pain, a stiff gait, reduced range of motion, increased filling of the joint cavity, thickening of the joint capsule, muscle atrophy, and obesity. They were treated with 400 milligram frankincense per 10 kilogram of body weight per day for 6 weeks. The treating veterinarians described the overall efficacy to be good or very good in 71% of the cases, and 40 to 70% of the patients were free of symptoms. There were statistically significant improvement regarding the intermittent lameness, but only at the time point of 6 weeks. Stiff gait, lameness while moving, and lameness after longer periods of rest was significantly improved. And osteoarthritis patients often show severe lameness when they rested for a while. So when they get up, they are really limping. And after walking slowly for a while, they improve. And sometimes you don't see any lameness at all after a few minutes. The same counts if the dogs are walked too much. So they were like forced to walk longer periods than they can, or exercise too hard. And for me, a rule of thumb is that the dog needs to get home walking as good as he did when he was leaving for his walk. And on the next day, they should be walking equally good. So if they walk worse the next day, then the workload was too much for them the day before. So many people think that they have to walk their dog for at least 1 hour per day, but many elderly dogs or dogs suffering from osteoarthritis are much happier if they are able to go out for 2 or 3 times a day and only take short walks. So read the newspaper and do their businesses, and that makes them much more happy than, walking like in a fast pace for half an hour or something. So they want to take it slowly, and it's much better for their joint health too. So in this study, 11 dogs experienced adverse events. 5 of them suffered from diarrhea. The other events weren't further defined, but this is needed to put emphasis on. Only 1 was ascribed to the study medication. Boswellia can be used on its own or in combination, and we already talked about combining Boswellia and turmeric to be quite common. Personally, I like to use it in elderly patients with chronic joint problems that tend to get worse when the weather changes. And especially these patients show problems when the weather is changing from warm and dry to cold and damp. And I think we see the same phenomenon in human beings that complain that their joint pain gets worse when the weather is wet and cold. There's one disease in dogs called autoimmune mediated polyarthritis, short IMPA. And conventionally, this is treated with steroids or chemotherapy. And frankincense might help with that in terms that it improves the quality of life of the patient. And sometimes the dosage of the conventional drugs can be reduced, sometimes even significantly. And so the positive effect of that is that we have lesser side effects. Overall, frankincense is, in my opinion, more suitable for patients that tend to respond better to steroids than to non-steroidal anti-inflammatory drugs like carprofen or meloxicam. So this is mostly elderly patients with chronic disease. Pregnancy or gravidity is a contraindication, as there had been reports of miscarriage when frankincense was applied. And pre-existing or noticeable gastrointestinal disorders might be a relative contraindication too. That sounds kind of paradox, as frankincense can be applied for the treatment of inflammatory bowel diseases. But think of it being a resin, so it is quite hard to digest. And some of you who might tried Boswellia themselves have already experienced that. So it can lead to stomach upset, and you might feel like you have to belch all day, and you think you eat it up and have the taste of it in your mouth all day long. So some animals feel the same way, or as we can, assume that they might feel the same way. So if you know that, for example, the dog already has a sensitive stomach, Boswellia might not be the best herb to choose, and dogs are more affected by this problem from my experience. So if you want to use it, after all, you have to find a combination or a formulation that is easily digested. And for example, there are companies that combine it or solve it in omega-3 or MCT oils so that it's easier to digest. Side effects mentioned are allergic skin reactions. The dosage of frankincense depends tremendously on the boswellic acid content and preparation. So for dogs, we'd use the dried herb or crude drug in a dosage of 25 to 500 milligrams per kilogram daily, optimally divided into 3 single portions. And in equine patients, there is no scientifically proven dosage, and suggested is to use the dried herb with 3,200 or to 4,000 milligrams per day if the boswellic acid content is 80% in the crude drug. Now I would like to share 2 cases from my practice. The first is Ira. Ira is a 4-year-old rescue dog. She was rescued from a Mediterranean country living on the street and presented for the first time when she was younger than 2 years. And that time she already was diagnosed with severe bilateral hip dysplasia. So until she grew mature, we tried to keep her as fit as possible. And when she grew up, they gave her a bilateral hip replacement 6 months apart from each other. Post-operative, she was still suffering from pain in the lumbar and sacral region, in the iliosacral joint, and in one knee. And she did not respond to any non-steroidal anti-inflammatory drug, but only improved when given prednisone. And we do not want to give prednisone to such a young dog long term because of the side effects. So she was put on frankincense amongst other things like physical therapy and regular acupuncture and chiropractic treatments. And with the frankincense, the steroid dose could be reduced at first for a while, and then we could completely taper it. And now she only is on her herbal medicine and gets a non-steroidal anti-inflammatory drug if needed. So, like on demand, on days when she's really bad. The second patient is a 16-year-old white horse. It's an Arabian gelding, and he has kissing spines, which means he has osteoarthritis of the spine and also pain in the iliosacral joint and melanomas. And melanomas are seen quite often or regular in white horses. They are mostly present in the skin, but might also develop internally, which is of course hard to diagnose because we cannot like look inside. So we have to open them up to be 100% sure, or put them in a CT, which is not so easy in horses because I think there's only 1 or 2 clinics that have a CT that is big enough to scan a whole horse. And there is some experience that these tumors might respond to therapy with frankincense, though it must be said that there's no scientific or evidence-based data available yet. So if anyone feels like conducting a trial about that, that would be a very good idea. Anyhow, this horse is getting frankincense for quite a long while now, and the melanomas that were visible on the outside have not grown further yet, and one of them actually got smaller. So you can only, it was like 5 millimeters in diameter when we started him a few years ago on frankincense, and now it's like the tip of a needle size. So it's really a good success, and he does profit a lot from the therapy as far as his mobility is concerned also. The next 2 herbs we're going to talk about are belonging to a group of salicin containing herbs. The first is Filipendula ulmaria or meadowsweet, and the second is Willow Bark, which belongs to the Salix species. Salicin is a naturally occurring prodrug, meaning it's a precursor, and it has to be metabolized by gut bacteria and then be transformed into active salicylic acid in the liver, which is the actual active compound. This is quite important. All of you know that acetylic salicylic acid is the active, or ASS, is the active ingredient in aspirin. And many people report that they get a very upset stomach if only taking 1 pill of aspirin. So this is because the salicylic acid is present actively in the gastric cavity when taking aspirin, whereas the herbs pass the stomach and start operating only when being transformed by the gut bacteria and the liver. And this results in a reduced harming effect on the gastric mucosa. Here are 2 pictures of meadowsweet. On the left side, the crushed crude drug in a quality like you can get it from Kräutermix. On the right side, the flowering herb like it is present in nature. Meadowsweet belongs to the family of Rosaceae. Used is the dried herb and the blossom, or mixtures of it. Its natural habitat is the northern hemisphere, so northern and southern Europe, North America, and northern Asia. And it is the herb that gave aspirin its name, so its ancient name is Spirea ulmaria. The constituents are flavonoids, mostly quercetin, tannins, different salicylates, salicyl aldehyde bound in essential oil, and mucilage. When you're looking at the salicylate content, it's only about 0.5%. And compared to willow bark that has up to 11%, it's quite a distinct difference. The assumption is that the effect of filipendula is not only attributed to the salicylics, but to the combination of all its active ingredients, what, by the way, counts for most of the herbal remedies. Quercetin might play a major role in the effects filipendula has, and there's currently a lot of research about it, as it is a very highly antioxidant substance. The name quercetin originates from the Latin word quercus, which means oak or oak tree. And when looking at quercetin content of food, capers and lovage have the highest quercetin content, but also red wine that is stored in oak barrels has quercetin in it because it directly diffuses from the oak barrel into the wine. So if you're a red wine lover, you're doing a good thing if it's not too much. Always depends on the dosage, of course. Quercetin is a scavenger of free radicals, and there are studies in professional human athletes that showed a higher resilience to high intensity training stress when given quercetin. And this was measured by looking at their muscle soreness scores, and the athletes that were pre-treated with quercetin had significantly lesser muscle soreness. And the assumption is that by acting against free radicals, quercetin reduces the acidity in the muscle. Furthermore, filipendula is said to have immune modulating effects in terms of having influence on the classic complement activation. The complement pathway is a reaction of the immune system to different foreign bodies, mainly, or for example, bacteria. And it is a pathway where several tissue hormones are released, and this leads to inflammation. And filipendula is able to harmonize this system. It also has blood thinning properties, which is a good thing because it leads to improved blood flow in the capillary bed. It has possible neuroprotective properties, and this is special about a drug that is anti-inflammatory, it's also gastroprotective. And this is said to be because of the flavonoids like quercetin, the tannins, and the mucilage. Meadowsweet can be used solely or in combination. In Western folk medicine, it was used for gastrointestinal disorders, rheumatism, and in children, and that is already a hint that it's a safe and well tolerated herbal medication. Personally, I use it for mild and moderate pain, especially of the stem musculature, for example, of the neck and back. And I tend to use it to a lesser extent in patients that are suffering from osteoarthritis, where bony deformation or joint alterations are present. So when they already have radiographic findings, but for me, the main indication is a tensed and hard, painful musculature. This can be athletes, so sports horses or dogs, and especially after competition when they had a short-term high stress on their muscles. And filipendula in these cases helps resolving the muscle soreness. Salicylate sensitivity is a contraindication, as well as pre-existing gastrointestinal bleeding. As far as dosages are concerned, one can find different information depending on which source or author one is citing. So in dogs, there is literature that says to use 25 to 300 milligram per kilogram per day, optimally divided into 3 doses. And other sources state 3 to 5 grams per dog per day, which is of course less accurate as it is not relating to the body weight. In horses, there's no scientifically proven dosage, but only empirical experience. And this is saying to give 10 or 20 to 50 grams of the dried herb as a daily dose. And as I already mentioned earlier, I like to start with a lower dosage and increase it slowly until the desired effect is achieved. For 2 reasons. First, I think I do not give more than I have to, and sometimes the acceptance of the horse is better when we're starting with a low dose and give them time to adapt to the medication. And on the other hand, using lower doses carries a smaller risk for adverse events, of course. Again, I'd like to share 2 cases with you. The first one is a 2-year-old dog who is doing agility sport. He comes to my practice for regular chiropractic and acupuncture treatments, and he tends to have tight and painful back muscles, and this looks like he has a posture like a koi carp, so a convex posture of the thoracic and lumbar spine. And then he has a weird hind limb gait, like he's making short strides, and when looked at from behind, his hind legs are very wide apart at the ground, and we always say he's walking like John Wayne. I hope everybody still knows John Wayne. So like a cowboy walk. The second patient is a 12-year-old horse. It's not an athlete, it's a horse used for just pleasure riding. He has a history of gastric ulcers and still having pain of the sternal and chest muscles. And the owner reports that he does not tolerate any conventional pain medication, like he was put on meloxicam, which is a selective COX-2 inhibitor that is usually well tolerated as it is already a quite targeted therapy, but still it can provoke gastrointestinal side effects, and this horse does not get along with it. And this pain around the sternum and the pectoralis muscles makes him what we say girthy. So when one is closing the saddle girth, he is sensitive and shows signs of discomfort. And when one is walking him immediately after closing the saddle girth, he is almost crossing his front legs, and this is because of this highly tensed, painful pectoral and sternal muscles. So both these animals receive low doses of filipendula as a supporting herbal treatment or supplement and get along with it quite well. The next plant we're talking about is willow, or in Latin salix. On the left side you see the shredded bark, and on the right side you see the tree in its natural habitat. Willows have a family on their own named Salicaceae. They are native to humid habitats in Europe, North Africa, and Asia. Pharmacologically used is the inner bark of the stem, and formerly not the bark of the stem was used, but only the bark of twigs from 2 to 5-year-old trees. The constituents are, of course, salicin, and there's a variety of salix species with different salicin content, varying from 0.5 to 11% depending on the species. And furthermore, it contains up to 20% of tannins. Clinical actions are anti-inflammatory, anti-rheumatic, antipyretic, which means lowering fever, antiseptic, so acting as a disinfectant, analgesic means pain killing, and astringent means pulling the tissue or shrinking the tissue, constricting it. I always imagine the tree standing in its damp or even swampy natural habitat, draining the earth and constricting the ground, and the same happens in the body with the tissue willow is acting on. Remember that willow or salicin is present as a prodrug here, so it does not have none or only minor effects on the gastrointestinal mucosa, so there's only a minor risk for gastrointestinal bleeding and no effect on platelet aggregation. When you think of aspirin, which is the most famous acetylsalicylic drug, it has a distinct effect on platelet aggregation, and therefore it is used in low doses in patients who had a myocardial infarction, but this effect does not occur when using willow bark. Regarding the evidence, there are several human studies that showed superiority versus placebo, so versus a sham medication, and non-inferiority versus NSAIDs like acetylic salicylic acid and rofecoxib in pain control and without adverse effects on the gastric mucosa. And willow bark is probably one of the most popular over-the-counter herbs for horses in, well, at least in Germany. Willow can be used solely or in combination. Common combinations are with meadowsweet, ginkgo, urtica or nettle, and dandelion. I like to use it with or for moderate to severe chronic pain in osteoarthritis patients or patients with lower back pain and recurrent fever. Recurrent fever means there are sometimes horses that have a high body temperature and it's really high, like 39 to 39.567 degrees, only for one day, and they're feeling really miserable and are also not walking properly. And then they have no symptoms for weeks, and then another onset with fever occurs, and doing diagnostics you cannot find a plausible explanation for the symptoms or plausible cause. And these patients I try to put on a long-term low-dose supplementation with willow bark, and what I see, and this is of course only my experience, is I have lesser fever events, and if the fever occurs again, it's lower than it was before. The therapeutic effect occurs after 1 to 4 weeks, so this is nothing for acute treatment, but only for chronic ones. And when we look at contraindications and side effects, of course, like with meadowsweet, salicylate sensitivity is a contraindication. And if you know that the patient has already had gastrointestinal ulcers, you should not give it either. Although it's not irritating the gastric mucosa directly, it has an effect on it due to its influence on the inflammatory cascade, so on the cells, on the gastric cells themselves, not from the mucosa, but from the bloodstream. And gravidity in the 3rd trimester, so if mares are carrying foals or dogs are having puppies, the 3rd trimester is also a contraindication for the use of willow. And we know from human studies that it is transferred into the breast milk, and in lack of data in animals, we also have to assume that it is the same, or the same counts for animals, so we're not giving it to lactating, breastfeeding animals. The dosage for willow bark for dogs is 25 to 500 milligrams per kilogram daily of the dried herb, optimally divided into 3 doses. In horses, the empirical doses for the dried herb is 30 to 55 grams per 500 kilograms per day. 500 kilograms is what we assume to be the average warm blood. That said, most warm bloods are having like 600 kilograms per day. Still, I would not adjust the dosage if it's, like I said, empirically not scientifically proven, so I would start with the low dose. So this is again a case example from my practice. It's a 16-year-old horse who is suffering from bone spavin and kissing spines. Kissing spines, we already discussed, is a osteoarthrosis or osteoarthritis of the spine, and bone spavin is a typical horse or equine disease where the ankle is affected by osteoarthrosis. The horse shows recurrent lameness and pain without any meteorosensitivity, so there's no dependence on the weather. But this, especially the bone spavin, always or from time to time leads to a swelling of the tissue of the joint and around the joint, and so this horse receives low-dose willow as an herbal supplement, and with that he's more stable. It does not free of symptoms, but he has lesser lameness and it's less often. In summary, we can say that there are several herbs available from different botanical families for the supplementary treatment of orthopedic pain. They have different modes of action and pharmacological focuses so that we can customize therapies for individual patients and meet individual patient needs. For some of them, the scientific and clinical evidence is quite promising, although compared to conventional medicine research, where the randomized double-blind and either placebo or standard of care controlled trial is the usual. There's some lack of data still, so it would be appreciated if the research is driven forward. On this slide, you find the references and sources I used to create this presentation. And if you want to look for further information, you can have a look at, for example, the website of the European Medical Agency, which has assessed quite a lot of herbs already, and there's a good summary of the research and knowledge we have on them already. Finally, I would like to thank you for your attention. I hope you enjoyed this presentation and it helps you with your everyday work, that I can help to get you familiar with these herbs a little bit more. I would like to thank Kräutermix for inviting me to speak to you about these herbs. And it's my last words to say bye bye, stay healthy, and hopefully see you soon.